Hello people, welcome to my channel Physio Guide by Divya. So today I am going to teach about tennis elbow. Tennis elbow. What is tennis elbow? It's also called as lateral epicondylitis. Lateral epicondylitis is also called as the tennis elbow. Anything we can say. Okay. Now, what is the lateral epicondylitis? Means this is the medial side. No, this is the of elbow. This is the lateral side of elbow. So the posterior side that connects the forearm, these are all the forearm muscles that connect the forearm muscles to the elbow. This is the elbow. So at this point they'll feel the pain, and this is called as the lateral epicondylitis. Okay, now we'll read the definition. An irritation of tissue. Irritation means that inflammation and this discomfort what patient feel. So the irritation of tissue connecting the forearm muscles to the elbow and the painful elbow syndrome. So that point is known as the painful elbow syndrome. So that which connects the it surrounds the painful elbow syndrome. It surrounds lateral side, this lateral side, medial side, posterior side, and posterior elbow syndrome. So common is the lateral tennis elbow pain. So this is the lateral, more common is the lateral tennis elbow, and they feel the pain and tenderness on the lateral side of the elbow from repetitive stress. Repetitive means more. At that point only more, if they'll use that tissue, if they'll use that hand more, and with that hand only they'll do all the work, or the pressure which falls at that point by doing more work. So that we'll call as a repetitive stress. Okay. Lesion. It's a lesion means damage by injury or by any disease. So that we'll call as a lesion. It's a lesion at this point. It's a lesion affecting the tendinous. Origin of the tendinous means this tendon origin from the common wrist extensors from lateral epicondyle. Okay. Now what are the clinical features? In this there are three stages. Mean 3 stages, 1, 2, 3. 3 stages. First one, acute inflammation pain during activity. So while doing activity they will feel acute pain. So there is no angioblastic invasion. What is angioblastic invasion? Means that embryonic cells from the endothelium of inside the blood vessels. So from this what it arises, endothelium, that is called as the angioblastic invasion. So there is no angioblastic invasion in this first stage, where there is acute inflammation, acute pain while doing activity. Now chronic inflammation pain during activity, and while they are in rest also they'll feel pain. So that is chronic inflammation pain. There will be some angioblastic invasion inside the blood vessels. Now next one, chronic inflammation, they'll feel at rest and night pain also, and they'll feel more pain while doing activity also. So in this we call this as the extensive angioblastic invasion, means more invasion is seen. Okay, more damage is seen. Now causes. What are the causes? Means what we understand as a physiotherapist by seeing the patient, what we understand medically. Okay, epicondylitis means lateral side will see there will be pain, inflammation. Okay, now inflammation of adventitious bursa. Bursa means adventitious means by external factors or by any accident. We'll say adventitious bursa tear. Okay. And calcified deposit means that calcium deposit build up at that area. So then the calcium will deposit more at the soft tissues only. It will deposit. Okay, so that it will be hard, and there will be no free movement at that area. Now painful annular ligament. That painful annular ligament means it's a strong band of fiber that encircles the head of the radius. Okay, at that point only annular ligaments are present, so they will be more painful at that area, those ligaments. Now pain of nerve origin. Now the nerve where it origin, that point also will feel pain, the nerve which origin. So more than 1.5 tennis players over 35 years of age, remember this age, 35 years of age, and difficult in types of household women who do more work without any rest. So by repetitive stress at that area, they'll feel more pain. More in tennis players by using this right hand, and more in the household works in women. Okay. Now how we'll do this clinical test to know whether it is a tennis elbow or any kind of a problem? Means there will be local tenderness, pain on extensor origin means this back side, extensor origin, and aching pain in back of the forearm. There will be pain, first one. Now restricted extension of wrist pain at lateral elbow, that is Cousins test. Means so restricted extension means we'll ask the patient to keep fist, and we'll catch them here near the lateral side, thumb is placed, and ask the patient to do extension. We'll do extension to move this hand to the lateral, move this elbow to the lateral side, so they'll feel pain at this area, lateral side. So that is okay, confirmation of the Cousins test. Okay, so pain at the lateral elbow. Now elbow in extension, passive wrist flexion and pronation produce pain. Elbow must be in extension, and passively we have to do wrist flexion and pronation produce, so this the patient complain pain. So this is also a test. Okay. Now treatment. What is the treatment we'll give for these patients? First one is the rest, painkillers. We'll suggest first, the surgeons will suggest this. Now in tennis players exercise like light racket, small grip, elbow straps should be firstly we will advise like so in tennis elbow players we'll ask them like light racket, this is the light shuttle bat, like light movements and small grip to hold, and elbow strap should be placed. Okay. Now injections of local anesthetics and steroids should be given at the first conservative methods. Stability we must give. Next one, physiotherapy management. What is a physiotherapist what we do? Now in acute phase only, we first will suggest them rest plus POP, that splint will keep that splint with elbow in 90 degrees flexion, like this, and supination. Wrist in slightly dorsiflexion is recommended. So this is recommended. See what is the first one? Rest. First is rest. Next POP splint with elbow splint. See. Think this is a splint. POP splint with elbow is in 90 degrees flexion. Supination means back side. Supination, wrist is slightly in dorsiflexion. Okay, this is recommended. Now thermotherapy means that heat therapy like ultrasound, shortwave diathermy, IFT also we can give like heat modalities to reduce the pain. Okay. Next one, cryotherapy to reduce swelling, redness, inflammation. Okay, cold packs for 15 to 20 minutes we will suggest to decrease pain. And electrical stimulation, if the hand is not moving and it is fixed, so we'll give the electrical stimulation to the muscle for elevation of the hand. Okay. And to decrease pain, massage, gentle massage for 15 days followed by friction massage for next 15 days. Gentle means light massage, friction means with the help of hands by doing more longitudinally, horizontally. Okay. Now next one, exercises, active exercises for shoulder, elbow, wrist, hand will suggest. Next one, so starting basic exercises. Next one, progressive resisted exercises to increase muscle strength with the help of weights, elastic bands. Okay, see here, with wrist with dumbbells with 0.5 to 2 kg, starting progressive resisted exercise. Next one, manipulation, it's not more recommended. Next, injections, like in the injection treatment like hydrocortisone is effective in certain cases, this hydrocortisone. Okay. Now after post acute, now we saw the acute phase. Now next one, post acute phase, strengthening exercises, strong isometric exercises in triceps, back muscles, active ROM exercises and wrist fingers exercises. Next one, strengthening a strong exercise to increase the strength of a specific or a group of muscles. Okay, this is known as the definition of the strengthening exercises. Now surgical management. Surgical management means for severe pain, if they will feel severe pain for 6 weeks to 6 weeks, and it will last for at least long time, so they will suggest them surgical management. Failure to respond to restricted activities, they not restricted activities, if they are not at all supporting, the hand is restricted and fixed to that part, so we'll ask them to go for surgery. Immobilization means not moving the hand for at least 2 weeks. Methods, how they'll do the surgical methods means pain. Percutaneous release of epicondylar muscles, so here they'll release that muscle, epicondylar muscle. And Basworth technique, arthroscopic release of common extensor muscles. Physio after surgery means after surgery also physiotherapist will guide them. So to control measures to control pain, first will control pain. First, as a physiotherapist, first will see them to control the pain, to decrease pain. Next will suggest them active ROM exercises, passive exercises, progressive resisted exercises. Next, thermotherapy. Okay, these are the basic exercises, and all physiotherapist will do this. So I hope you understood this topic. I'll give the notes also. Thank you for watching this video.